Conversations That Matter is a partner program for the Centre for Dialogue at Simon Fraser University. The production of this program is made possible thanks to the support of the following and viewers like you.
Alan Eaves, if there's one word that describes him, it would be unprecedented. Alan and his wife Connie not only established the Terry Fox Laboratory for Hematology and Oncology Research, they then went on to found and run STEMCELL Technologies, a company that supports stem cell research. Over the past 24 years, STEMCELL Technologies has grown to become the most successful biotech company in Canada. The odds of succeeding in the biotech world in Canada are slim. Of the 1 in 10 biotech startups that survive, most are sold to American companies that then move the company and the people south. Mr. Eaves, who is a proud Canadian, determined he had to retain ownership and control of his company to ensure he could keep those jobs and the export revenues here in Canada. To talk about what it takes to build a biomedical juggernaut in BC, his long-term plans, stem cell research developments, the role of regenerative medicine, and his hopes for BC's biotech sector, we sat down with the remarkable Alan Eaves for a conversation that matters. Mr. Eaves, thank you for hosting us here at STEMCELL Technologies for a conversation that matters. And I think that it matters because you've done something very unique in the biotech space. You have created what is now Canada's leading biotech company. What was it about British Columbia that made you say, I'm going to do it here? And then how did you manage to do it?
Well, I was here, so that's why I did it here.
Could you have ever envisioned where you are now when you started?
No, I didn't envision. I wanted to be a biological philosopher initially, and then I realized that I had to get some training, and so I did a master's in what was at that time yeast genetics, and then I saw that I really needed medicine, so I did medicine. I did internal medicine, and then medical oncology. And in the course of that, I also did a PhD at the University of Toronto. And getting all that information, you do tack on a few years. Mm-hmm. And so then when you actually get a job, you find yourself quickly into administration. And I didn't realize, because my wife and I basically built the Terry Fox lab here in Vancouver. And then I became head of hematology and helped to build our bone marrow transplant program. And we needed all this understanding of blood-forming stem cells in order to do our jobs better. And that was the sort of basis of all this. But I never anticipated forming a company. And in fact, it was just to make a little money initially. But then as some of my mentors saw, who were advising me on the board of the stem cell fund, of the basically the Cancer Foundation and the agency, they said, you should start a company, because this has huge potential. I didn't believe them, but I did start a company, and they were right. It has huge potential.
So that helps a lot. But were there advantages that British Columbia brought to the equation?
Well, there's a lot of creativity, and the work that we were doing in the Terry Fox lab, where I was working at the time, said we could make a product that would support the growth of blood-forming stem cells because we were making it ourselves, and we could sell it around the world and make some money that would support our research. So that was the basis of it. It was all about trying to get money to do our research. And as you probably know, for researchers, there's never enough money to do all the research that they can think of doing.
But what do we have to do as a provincial jurisdiction? The universities, investment, the support of tech, whether it's high tech or biomedical. What is it that needs to be in place for us to be able to continue to grow and build upon this success that you've had? And when we take a look at the high tech sector, we see it moving along there, but we want to be able to bring that same kind of success here for biotech.
Well, it's having individuals that are prepared to take the risk and go off and try to set up something new. I mean, it's really a very individual thing. I mean, governments can put, start up grants and things like that. Yes, those are helpful. But you have to have people with passion who want to make it happen. And there are quite a few around, and it is happening. It isn't obvious until something becomes quite big, you see. But there's a lot of stuff going on below the radar, I would say. And it's all maturing here nicely. We're building a major biotech community here based on the needs of regenerative medicine.
So in the past, we have had biotech companies in BC that looked like they were going to become that initial center of influence that would create a community of other companies. They came and went. You're still here. How important is it to you that you can play a role not only in the development of stem cell technologies, but also in the incubating or fostering of other biotech firms here in British Columbia?
Oh, well, we're very keen to support the ecosystem of biotechnology here and be closely related with the universities, especially UBC and SFU. And, this is my passion. I mean, how do we create really good products that support cancer and other researchers?
How important has it been for you to be able to manage your own strategy by retaining control of your company?
Well, I'm big on control because if you look at a lot of the biotech companies that start, the successful ones get sold off usually to an American company, and then they go south. People lose their jobs, or they go to the U.S. So I'm a bit of a Canadian nationalist. I want to keep everything here in Vancouver and in Canada. And the only way to do that is to keep control. So basically, I own the company outright, but I'm not interested in making money. I'm interested in basically making really good products that support cancer and other researchers do their jobs better. And the other thing is I really want to do this because we have all these smart young kids that love science, but there are no jobs in academia. They're all basically filled up. It's just a small subset of what is available. We need industries that now take those smart kids and give them opportunities to create new products and really fulfill their life ambitions, which is all to do. Everybody wants to do good things, right? And so how can we give them the facilities and the opportunity to do that? And that's what we really are doing in stem cell technologies.
So what exactly was that first product?
Well, it was methyl cellulose, which is a goo that's a filler in chocolate chip cookies and other things in food. But we use it to separate cells from each other. So the assay that we do is in your blood, there are white cells. Of the 10,000 white cells, only one is a stem cell. And you can't tell them apart. They all look the same. But if you put them in our special media, and the cells are all separated now and held apart by the methyl cellulose, those cells that are true stem cells start to grow. And they form little colonies of cells. All the other ones die off. All the regular white cells die off. But these true stem cells start to grow and reproduce. And that's the characteristic of a stem cell. It's able to produce forever, right? And so we had these colonies growing, and we call that a functional colony assay. It asks a cell to declare its existence as a stem cell by growing and producing other cells.
And that can happen because you give it the right environment to allow it to take place.
Yeah, so it's not just the methyl cellulose, it's all the other goodies that we have to add into it, like fetal calf serum and bovine serum albumin and all sorts of amino acids and vitamins and stuff like that. And that's the sort of secret sauce that allows these cells to really grow and flourish.
It's a complicated formula.
Yeah, and so we look to see blood-forming stem cells give rise to white cells, which fight infection, red cells, which carry oxygen, and megakaryocytes, which evolve into platelets and help our blood to clot when needed. So it's a stem cell is a cell that can grow infinitely in terms of numbers, but also gives rise to other cell types.
And what it can become as well.
Right. Well, you want the stem cell to remain a stem cell. But so each division, you want to have something that's going to go off and give rise to these differentiated cells like red cells, white cells, and platelets. But you want to keep the stem cell population there always to back up the need, right? And the stem cell typically sort of senses, we don't know how, but senses when more of the mature cells are needed. And it's otherwise sort of sitting there sleeping a bit and comes on board when more cells are needed, right? So there's a lot of controls in there that we don't understand how that works.
And so it's important to mention that you're not actually doing that work. You're providing the instruments or the products that researchers can do that kind of work and then work towards medical outcomes.
Yeah. So we jokingly say we provide the picks and shovels for the stem cell gold rush. We're not actually going after the stem cells to turn them into clinical products that are useful to patients, but we're giving researchers and clinicians the tools to allow them to do that.
How do you then put that to work when, let's say, I need stem cells that are related to my pancreas versus him who needs it for his heart?
Well, you could argue the holy grail of all this would be able to take a cell, turn it into an insulin-secreting cell, and give it to a patient, their own cell now. You're just taking their own cell, turning it into an insulin-secreting cell, and inject it back into them to replace the cells that are damaged and are not functioning in their pancreas. Mm-hmm. And we know this can work because the Edmonton protocol is where some surgeons there, by the name of Shapiro, actually developed a way of taking the pancreatic islet cells from people who've recently died,
yes,
and injecting them into the liver via the portal vein where they lodge, and then they start producing insulin in a normal way. Mm-hmm. And that will last for a year or so, but those patients require big league immunosuppression, which over time is toxic. But if you could take the patient's own cells and get them to become insulin-secreting cells and inject them into the portal vein of the liver and have them lodge in the liver and function normally, that would be wonderful.
We're not there yet.
No, but there's a lot of work being done on that, and of course it's our media that a lot of people use to understand how to grow these cells and get them to produce the products that we want, like in this case, insulin. But the same thing is for Parkinson's disease. So Ivor Mendez in Saskatoon has developed a way of taking certain cells from basically what are we would call stem cells, and inject them back into the substantia nigra of the brain, where they will then produce dopamine and replace the damaged cells that are not producing dopamine there. And that makes some patients with Parkinson's really a whole lot better. Mm-hmm. So it's these sorts of things that are really intriguing people.
So does this mean that any part of our body can then be a generation point for new stem cells?
Oh yeah, well this is a really exciting era now because what's happened since it all started out with blood-forming stem cells, and it was an area pioneered in Canada by Till and McCullough at the University of Toronto, where my wife and I studied. But now the big thing is Shinya Yamanaka in 26 actually discovered that you could take any cell and give it certain factors that would turn it into a stem cell. And for that, he got the Nobel Prize in 2012. Mm-hmm. So this is a seminal event. Basically, you can take any cell of your body and turn it into a stem cell. I mean, I'm exaggerating a bit to make the point, but that is the potential.
How many products do you have now?
Well, we have over 2,000 products in our catalog. Yeah.
So how did you go from 1 to 2,000?
Well, in the area of media, the idea is you want to grow these different types of stem cells because every tissue or every organ has some stem cells. So understanding how they grow and what they need. So all different types of media. Then this induced pluripotent stem cell concept came along. Now people want to get those cells to grow them up and then differentiate them down into different cell types, like cardiomyocytes to treat coronary artery disease, right? And things. So we have all sorts of different products that help these stem cells grow over time, but then to preferentially differentiate down to give neurocells or cardiac cells or hematopoietic cells or whatever. And so all these combinations of goodies allow us to manipulate all these different types of cells. And that's pretty exciting. But then you also want to be able to separate these cells. So one of my colleagues basically developed a way of separating cells by using antibodies on which are little particles of iron. And you get those antibodies to stick on certain types of cells, and then you put them under a magnet, and that pulls away the cells that you want, leaving all the other cells behind. And you can turn it around the other way and say, I want to remove all the cells that I don't want, leaving the cells that I want untouched without any antibodies stuck on them. So we have a whole, hundreds of products to do different types of cell separations.
And how big of a role will regenerative medicine play in the overall scope of your work as you move forward?
Well, it's huge. I mean, traditionally, treatments are with chemicals that you give patients, right? Mm-hmm. This regenerative medicine is about using cells to treat patients. And of course, using them to replace damaged cells or to go after cancer cells with this CAR T cell thing, which we're also involved in. So we have a big contract from General Electric Healthcare to actually help them get into this field with some of our products. These are huge opportunities. So we're all about seeing this grow to be a way of getting at all those diseases that are really chronic diseases, mm-hmm. which are economists say are probably 70 to 80% of the cost of healthcare. So if we could, cure arthritis and these autoimmune diseases and these failures of organs like diabetes and Parkinson's and Alzheimer's and so on.
And get to them before they fail.
Exactly, yes. Mm-hmm. And understand, and we will help to understand these diseases by understanding the biology of the cells that are failing. So there's a knowledge thing that we're also heavily involved in, just understanding cell biology in general, how cells poop out in our old age, and how we can delay that and change it. And that's regenerative medicine.
Are we not then pushing back the envelope of the limits of human life if we're doing that?
Yeah, well, absolutely. I mean, most of us don't want to die. We're having too much fun, right? So if we can extend this further, that's fair game, right? So, yeah.
So I know you have more than 1,000 people working for the company, but how many people in your company are working in research and development? So they really are those intellectual jobs that are so important to the future of our economy.
Well, it's over 200 people are doing actual research. So we put 15% of our revenues into research. But we have a lot of other smart people. See, because this is a very high-tech area, and we're selling to very sophisticated scientists, they want to understand all the things, why our products would work or not work, and how they would work, and so on. So 40% of our salespeople are PhDs, and about the same number are MSCs, and everybody else is a BSc. Mm-hmm. So we have about 150 salespeople out around the world dealing with what we would call, leaders in the field in all these different areas of stem cell biology and just immunology and genetic research. Mm-hmm. So they have to be really sophisticated people in order to deal with their very sophisticated customers.
Now you are at a point where you have perspective and you have vision about the future. What does the future look like 15 years from now, where stem cell technology is going to be?
Well, we're in the process. We have what's called our railway project, which is because the railway, the Canadian National Railway, opened up the West to bring in resources and take out raw materials, and that fostered the development of the Canadian West. So we see this initiative as actually opening up regenerative medicine with all the tools that we can help to provide this field. And in order to do that, we need some support. But if we continue to grow at 20% a year, which is our average growth over the last 24 years, we over the next basically 15 years, we're going to be hiring 5,000 more people, and our sales will be well over $1 billion, and we'll be even more of a global company. The Canadian market is small. Only 3% of our sales are in Canada. So but we're the perfect company that governments want to support.
You're a great exporter.
Yeah, we bring in those export dollars that are worth 2 to 3 times the value of dollars generated within an economy. And so we're going to continue to do this. And of course, I would like to see this evolve into supporting all the things we do in healthcare, which is a huge cost center in Canada and everywhere. How can we turn it into a revenue generator? And it's through forming companies like this that will do that.
Where are you going from here?
Well, we have we have 4 buildings. We have staff in 4 buildings. This building is the old Angitech building on Station Street, and we have about 300 people here. This is strictly research. Downtown, we have 3 or 4 floors in the Vancouver Centre where we have sales and marketing and other groups. And then on the corner of Ashen and 7th, we have our manufacturing facilities in that building. And then out in South Burnaby, we have a huge warehouse where we have all our raw materials and our finished goods. And then we have another big warehouse in Seattle, another one in Grenoble, France, and another one in Singapore, and another one in Shanghai, and another one in Beijing. We are going for world domination, and it's all working out nicely.
How long are you going to keep doing this?
Well, you know, I'm going to discover the secret of longevity through stem cells, and I plan to live forever. So people ask me what my exit strategy is, and I say, well, probably not, but ever, but it will probably be death.
You want to keep going?
I want to keep going. I'm having so much fun.
That means you're never going to stop growing stem cell technologies.
No, absolutely. We're going to keep it going.
Well, I appreciate that you have been such a formidable success here in British Columbia, and that you've decided and determined that this is the place you want to keep the company, because I think that we all benefit from it. So thank you very much for being a part of this conversation. It's fascinating.